also the weather update for the 29th of July, 2020. I am Lesroy Williams. I thank you very much for joining us for this briefing. Of course, we continue to update you on the management of the COVID-19 pandemic here in St. Kitts and Nevis. And equally, we remember that we are in the hurricane season. And so from time to time, we update you as well in terms of what is happening with respect to the weather. I would like to invite Mr. Elmo Burke, our Senior Met Officer, to give us an update on the weather. Mr. Burke.
Good evening, citizens and residents. Thank you, Mr. Lesroy Williams, for the introduction. Earlier this evening, we would have recognized some things early this morning. Post-tropical cyclone number 9 would have been shifting south and away from the island chain, and as such, the weather conditions would have been improving as the day progressed. As of 5 p.m. today, tropical storm warning were discontinued for us here in St. Kitts and Nevis. At the same time, 5 p.m., tropical cyclone number 9 was located at 16.4 degrees north, 65.6 degrees west, and that puts it at about 200 miles to the west-southwest of St. Kitts. It was moving in a west-northwesterly direction at 23 miles per hour with maximum sustained winds of about 45 miles per hour. Based on the trajectory, it will continue to move away, further and further away from St. Kitts and Nevis, and as such, the weather conditions are expected to improve. Nonetheless, we are anticipating some more rain bands to move over the island chain from tonight into tomorrow morning. And as such, some disruptions are possible. Seas are expected to remain rough, and as such, a small craft warning will remain in effect. I thank you.
Thank you, Mr. Burke, Senior Met Officer. I now invite Mr. Brian Dyer, who will join us via video to address us. Mr. Dyer is the Director of the Nevis Disaster Management Department.
From the Nevis Disaster Management Department and from the island of Nevis, we have continued to monitor the passage of the tropical weather system. As Mr. Buck indicated, it's now some 200 miles plus to the south-southwest of St. Kitts and Nevis, and we have seen gradual improvement. The winds have subsided considerably, and also some wave activity has also subsided. However, we have seen a marked increase in the rainfall activity. From our last report, we have seen an increase in the rainfall. In specific areas such as Spring Hill, we have seen recorded some 53.59 millimeters. Cades Bay in the northwest, we have recorded 55.39 millimeters. Nizu Plantation in the north, we have recorded 22.30 millimeters. Morgan Estate in the east, we have recorded 61.60 millimeters. That's well over 2 inches of rainfall. And New River in the southeast, we have recorded 34.60 millimeters. Also, from earlier in New River, we measured 38.50 miles per hour wind gusts, and that occurred this morning at 7:10 a.m. So we continue to see a gradual improvement in our weather. Our population and general community has remained off the streets, so that's a plus for the emergency services. And we want to say a special thank you to our general population for obeying the call for them to remain at home and to ensure that the emergency services had little issues with regards to responding to whatever calls that we attended to this morning and early this afternoon. So again, we continue to see improvement. I want to appeal to the general public again to maintain their vigilance as we expect more rain showers this evening. Those persons living in close proximity to our waterways to be mindful that in the event of excessive rainfall overnight, they may be need to evacuate those flood-prone areas. So again, thank you for participating in our monitoring of the storm and for your participation in keeping our roads clear and safe. Again, thank you very much to all.
Thank you very much, Mr. Dyer, for sharing with us. I now invite Mrs. Claricia Langley-Stevens, the Deputy National Disaster Coordinator, to address us. Mrs. Stevens.
Good evening, and thank you, Lesroy. The National Emergency Operations Center, which was activated at 7 a.m. this morning to support the tropical cyclone 9 and its effects on St. Kitts and Nevis. Continuing on with the updates, the cable indicated that the services that would have been interrupted are now 100% restored, and that was as a result of the loss of power because of the situation that we've been addressing with SCELEC. At this time, I'm going to allow the General Manager, Mr. Jomo Williams, just to bring a further update as to the situation on the ground with the SCELEC department.
Good evening. Thank you, Mrs. Langley-Stevens. SCELEC wishes to advise the general public that in terms of restoration, there are just 3 areas that remain affected. On the Sandy Point feeder, Green Tree, Cornfapes, Halfway Tree, that is expected to be completed by 8 o'clock tonight. The Keon feeder, Molyneux and Mansion, that transformer would need replacing, and that is expected to be done in the morning. And the Frigate Bay feeder, we are about 90% complete, and that will be done later tonight. Any other person experiencing power outage at this time, you are asked to call 465-2013 to get in touch with our operators, or 465-2000, and leave your information with our IVR system. We constantly back-check these systems and verify all the information, and we once again apologize for the inconvenience that was caused today, and promise you that SCELEC is forever working to get everything under control. Thank you.
Thank you, Mr. Williams, and I know the general public must be extremely happy because we are slowly improving. As we continue with the updates from the NEOC, the Fire and Rescue Services responded to a call of a downed tree on Market Street, Central Market Street, and that tree fell on a home where a family resided. Thankfully, there were no injuries. However, the report indicates that the tree needs to be assessed because it's a really huge tree, one of age, and that assessment will be done tomorrow, but there was some mild clearing of the area so that the family can have access to the home, and so we are very thankful for that. Community and Social Development has reached out to the family to ensure that the support that can be given to them was made available. So I want to thank the general public who contacted the NEOC with that information. Damage assessment. The Damage Assessment Committee indicated that the assessment done at Old Road Bay area was a very successful one, and the area was deemed safe and clear, and we are very thankful for that. Further assessments will be done as we progress into tonight and to tomorrow, so that these updates can be provided to the general public. Please note that the emergency contact numbers, you can still reach the NEOC via the NEMA office numbers, which would be 467-1151 or 466-5100, that's 5100. And you can contact the NEOC at 466-7453 or 466-9626 or 466-3874. Please note that any information that you share with us is given immediate attention so that we can ensure that all of us continue to remain safe. Thank you so much.
Thank you very much, Mrs. Langley-Stevens. We do apologize for some technical difficulty that was being experienced with transmission. Some people could not hear very well what was being said. We do apologize. I now invite Superintendent Cromwell Henry, Divisional Commander for District A, to address us.
Thank you, Lesroy. President, good afternoon, good evening to those listening to this broadcast via whatever means. I know this is a NEMA briefing on the passage of the storm, and I'm pleased to report from a law enforcement perspective that there were no issues, no calls for assistance, no criminal activity arising out of the passage of the storm. So from a law enforcement perspective, it was very peaceful. And so I would turn my attention to COVID-related matters as the storm has passed, I'm advised, but we are still in the COVID period, and we approach another holiday weekend, which is usually punctuated by celebrations. And these celebrations are things that are restricted. And so I think we have a responsibility as law enforcement to remind the public of their obligations under the law and what the law requires from them. I will advise that new regulations have been published on July 25th. And these regulations are just an extension of the previous regulation. Nothing new has been included in the new regulations, which will expire on August 1st, when we expect new regulations to be published. However, the current regulations, and we reasonably anticipate going into the new regulation, the same provisions or some of similar provisions will remain. The protocols, the main protocols that are geared to prevent the spread of the coronavirus. The period that we are entering, the holiday period, as I mentioned earlier, it is usually celebrated with beach parties and other mass public entertainment events. We want to remind promoters and entertainers, and by extension the general public, that these events are restricted, continue to be restricted under the emergency regulations. Additionally, permission in writing from the police is required to host these type of events or any public event that require the use of noisy instruments. I wish to read from the Act. I like to quote specific provisions so that persons do not think that these are just recommendations from the police. Section 56 of the Small Charges Act, under the caption "Control of Music in Public Places," reads as follows: "No person shall, except during carnival, without license under the hand of a police officer not below the rank of inspector, beat any drum or play any noisy instrument in any street or public place, and any person who contravenes the provisions of this section shall be liable to a fine of $5,000 or to imprisonment for a term of not exceeding 1 year. This is simply saying that if you want to host any event that requires the use of noisy instruments, you must get a license in writing from the police, and it must not be from any rank below the rank of inspector. Regulation 10 of the emergency regulations restricts private parties and other similar social events, including picnics and beach parties, and provides for penalties of up to $5,000 or imprisonment for a term not exceeding 6 months or both. So we see both pieces of legislation, the Small Charges Act and the emergency regulations, places restrictions on the use of these instruments and the hosting of these type of activities. So we want to remind the public that there are serious consequences for violations under these particular legislation. And again, these legislation, in particularly the emergency regulations, is geared towards public safety and to prevent the spread of the virus. We were told by the medical authorities that the virus is spread when persons who are infected come into contact with other persons, and droplets transmit or goes on persons who are not infected, and they eventually become infected. So protocols have been established and have been placed in legislation to prevent the spread, and these protocols, we are well aware of them. We repeat them day after day: the wearing of masks, hand sanitizing, social distancing, good sanitizing behavior. All these basic protocols are geared towards the prevention of the spread of the disease. And so we urge residents to take their own safety as their own personal responsibility and comply with the provisions of the legislations. Thank you.
Thank you very much, Superintendent Henry. I now invite Chief Medical Officer Dr. Hazel Laws to present us with the Health Emergency Operations Center COVID-19 report. Dr. Laws.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. As per usual, it's my task to share with you the Health Emergency Operating Center Situation Report for Wednesday, July the 29th, 2020. Now, as at last Friday, July the 24th, the World Health Organization reported the largest single-day increase in the number of cases since the pandemic started at the beginning of this year. So last Friday, we saw an increase in the number of cases. The increase was as much as 284,000 cases in just 24 hours. Now, the biggest increases were seen in the United States of America, Brazil, India, and South Africa. As at today, July the 29th, the total number of confirmed cases of COVID-19 is now over 16,500,000 cases. If you were to calculate the difference between last Wednesday to this week Wednesday, there is an increase of 2 million. Yeah? So today, 16,500,000. Last week, it was 14,500,000. In terms of the death toll is now at 656,093 cases. What's happening in the United States of America? As at today, the number of cases, 4,380,871 confirmed cases of COVID-19. In terms of the death toll, it's over 149,000 cases. What's happening in the Caribbean region? Well, as at the last situation report coming out of the Caribbean Public Health Agency, the total number of confirmed cases is now over 100,000. So the 100,000 mark has been passed. In terms of recoveries, 44,298 recoveries, and the death toll is 1,705 as at July the 27th. Now, this is good. This is good news for the Caribbean region, because if you were to calculate the death rate or the fatality rate within the Caribbean region, it's at about 1.7, and that is a little lower than the global or international rate. And I hope that this trend continues. Now, based on the latest report coming out of CAFA, the report states that the risk of further cases occurring in the Caribbean area continues to be very high. What's happening in St. Kitts and Nevis? To date, we have tested over 1,000 persons. So as at today, 1,006 persons have been tested, and so this is good. To date, we've tested all those persons who were suspected of having COVID-19 along with their contacts. And so the number tested, 1,006 persons to date. In terms of quarantine, at present, we have 50 persons at government-designated facilities, and we have 1 person in isolation. In terms of returning nationals, we continue to accept our nationals who have requested to repatriation. And so at present, we have 51 nationals in quarantine, 35 in St. Kitts and 16 in Nevis. Between April the 24th to today, July the 29th, a total of 145 nationals have returned to the Federation in the context of COVID-19, 93 females and 52 males. This afternoon I have good news, all right, and so we have 16 of our cases have now recovered. We only have 1 active case at present, and so I repeat, 16 of our cases have recovered, and we only have 1 active case. The patient continues to do well and is stable, recovering nicely. Now, this afternoon, I want to spend some time talking a little bit about living with diabetes in the context of COVID-19. And so I want to reach out to those persons who are diagnosed with diabetes mellitus and what it is you need to know in terms of what are the recommendations you need to follow in the context of COVID-19. And now I'm going to share with you the latest evidence or information coming out of an article that was published in the Lancet, a renowned medical journal, as late as July 17th this month, earlier this month. It was entitled COVID-19 in People with Diabetes, Understanding the Reasons for Worse Outcomes. And so basically, the scientists, they looked at some patients with COVID-19 in China, in Wuhan, 1,561 patients who were diagnosed with COVID-19 at a hospital in Wuhan, and they found that those with diabetes were more likely to require admission to the intensive care unit. Another set of scientists, they look at a cohort of in-hospital patients with COVID-19 in the United Kingdom, as many as 5,693 patients, and they found that the risk of death were more common in those with uncontrolled diabetes. All right? And so let's talk about diabetes in general. I think we are all aware of one fact, that diabetes is known to confer or result in an increased risk of admissions to hospital for infections like respiratory tract infections. And so diabetics in general, they have an increased risk of picking up infections, and so it's not unusual for a diabetic to be admitted for a respiratory tract infection. And also, they looked back at what transpired in the SARS outbreak, the MERS outbreak, and the H1N1 flu outbreak, and they found that diabetics had an increased risk of picking up these infections. However, what is the science telling us now about diabetes and COVID-19? Well, this latest journal article, what it is really saying is that this does not seem to be the case for COVID-19. So in other words, they are finding out that diabetes does not really increase the risk of you picking up or contracted COVID-19. Diabetes, however, is more frequent in patients with COVID-19. In other words, if you contract COVID-19 and have diabetes, the risk of you developing the severe form of COVID-19 is increased. So the disease does not increase your risk of picking up COVID. However, if you are a diabetic and pick it up, the chance of you developing the severe form of the disease requiring hospitalization is increased. And so patients with COVID-19 and diabetes have a worse prognosis. So that is what the article or the science is telling us. Patients with COVID-19 and diabetes have a worse prognosis, most probably because of concurring effects of multiple factors, because of other factors. And these factors include age, poor blood sugar control, and the presence of other chronic conditions. So in other words, if you have COVID-19 and diabetes and you are over 60, your outcome will be poorer. If you have COVID-19, diabetes, and your blood sugar values are not controlled, your outcome would be poorer. Yes? So poor glycemic control or poor blood sugar, poor control of your blood sugar values before hospital admission and during your hospital stay will worsen your outcome if you do get COVID-19. So in other words, if you are diabetic, it is very important that you control your blood sugar values. So that's the biggest takeaway message. If you have diabetes, in the context of COVID-19, the most important thing you need to do is to get a handle of your blood sugar values. You need to really manage your blood sugar levels and get your blood sugar values down to their normal levels. The other factor is that patients with COVID-19 and diabetes have a greater prevalence of other chronic illnesses like heart disease, stroke, and kidney disease. Actually, those countries, China, Europe, United States, what they are finding is that if you have COVID-19 and diabetes and poor or impaired kidney function, your prognosis is poor. Yes? And so these are the recommendations for persons living with diabetes in the context of COVID-19. 1, we want you, or we recommend strongly, that you maintain good glycemic control. In other words, we want you to maintain blood sugar values that are normal. We want you to monitor your blood sugar values on a regular basis. Secondly, we ask that you take your blood sugar medication as prescribed. So we want you to be compliant with your prescription medication. If you have other chronic medical conditions like hypertension, heart disease, kidney disease, we want you to be compliant with all your prescribed medications. Adhere to your prescribed diet, eating fruits and vegetables, and we want you to exercise regularly because the appropriate diet and exercise will help you to gain good control of your blood sugar values. We want you to boost your own immune system, get adequate rest, keep well hydrated by drinking the good old plain water, get adequate sunlight, and take your multivitamins and supplements. If you are living with diabetes, you must protect yourself from the new coronavirus. Always wear your face mask when in public spaces. Practice good hand hygiene. In terms of physical distancing, ensure that you maintain adequate distance between yourselves and others, at least 3 to 6 feet away from others. And avoid social gatherings. Avoid mass gatherings where you have a lot of people gathered together. So in summary, diabetes does not seem to increase the risk of your contracting COVID-19. However, older persons with COVID-19, diabetes, and other chronic medical conditions seem to have a worse prognosis. And so we recommend that if you are living with diabetes at this time, the main thing you need to remember is to maintain good blood sugar control, maintain good glycemic control, monitor your blood sugar values, make sure they are normal, and boost your immune system. Thank you.
Thank you very much, Dr. Laws. I now invite Mr. Abdias Samuel, who is chair of the COVID-19 National Task Force and the National Disaster Coordinator, to give remarks.
Thank you, Mr. Williams, and thanks to all who are tuning via all means to listen to this briefing. We want to review the actions taken by the National Emergency Operations Center and also all of our stakeholders in response to the passage of the potential tropical cyclone number 9. We would have heard from the Deputy National Disaster Coordinator and also from Mr. Elmo Burke, and we can certainly say that we, for now, are in the clear of this potential tropical cyclone. However, we encourage the general public to remain vigilant as the outer feeder bands can still provide some showers in the upcoming hours. I want to basically highlight for you some of the agencies that have functioned during this activation, in particular the Royal St. Christopher and Nevis Police Force, the Defense Force, St. Kitts Nevis Defense Force, the Fire and Rescue Services, the National Emergency Management Agency, and the Nevis Disaster Management Department. You would have also heard of from the National Emergency Operations Center Director, and also from the chair of the Health Emergency Operations Center, in that of Dr. Laws. The prison facilities, those who would have turned out to work today, all hospital and healthcare and medical facility staff, and also the media personnel, in particular to that of ZIZ, and all other media houses who have been participating with the 3 updates or briefings that we would have had today. Critically important, I must acknowledge the public utilities, telecoms, and all other departments and public servants who would have assisted in whatever way today. This Herculean effort by all shows the all-of-society approach that we have adopted in fighting COVID-19 and also in safeguarding the nation from the threats of any potential tropical cyclones. I really want to acknowledge also some other agencies, companies that would have partnered with us today. The ham operators, the Red Cross Society, who provided the overwhelming support, and the cooperation as we saw the passage of this potential tropical storm on the Federation of St. Kitts and Nevis. So on behalf of the NEOC executive, we are thankful for their support, which captivated and motivated us to know that you are part of this whole of society approach. And we thank the persons from the general public for coming forward and expressing your interest to join NEMA volunteers. I think that is something that is commendable and rather motivating. So we thank you for those efforts. And at this moment, I also want to acknowledge the Permanent Secretary within the Ministry of Health, Ms. Dolores Stapleton Harris, who has been with us since morning. And these are the kind of support that we need from our senior public servants who have to make critical decisions when it comes to the country during these times. However, like everything else, we are seeing some challenges from some business places, and all we are asking for the business places to continue to comply rather than disregard the protocols that are implemented to ensure that we have a high level of safety and security for the Federation of St. Kitts and Nevis. Today, we would have seen a number of businesses who would have opened, in particular bars, and people were enjoying themselves, getting drunk, rather than complying with the regulations, because we are still under a state of emergency. That's the reality. The emergency powers were not discarded because of the passage of this potential tropical system. They remain in place. We said it from morning, we said it at the afternoon, and we are saying it now in the evening, and they were re-emphasized by Superintendent Henry. I'm asking all business places to continue to comply with these regulations. Again, the regulation states if you fail to comply with the regulation, you will not be able to operate. And we have been saying this from day one. I also want to urge you to consider your position and join us as we continue the fight with the pandemic during the hurricane season. It's very critical. We welcome your contributions. We welcome them in any form, whether human resource, whether financial or otherwise. We have a lot of work to do. We are in the peak of the hurricane season. This is not time for us to segregate or time for us to have divisive dialogue. This is time for solutions, implementation of solutions, and moving the Federation forward. Now, many persons in the business community have reached out to me about the activation and the instructions by the Honorable Prime Minister about the stay-at-home order. Let me state that I, Abdia Samuel, as the National Disaster Coordinator, endorsed and supported the actions of the Honorable Prime Minister, Dr. Timothy Harris, in calling a stay-at-home order. This was not just done out of order. We consulted with a number of stakeholders. We consulted with regional partners. Our 2 mitigation council ministers would have had dialogue with cross-sector of our society, and we came to a conclusion that the best action to protect our citizens was to give a stay-at-home order. And I think our citizens responded very well, and I commend the citizens of St. Kitts and Nevis for this response, as we may face further tropical storms threats going forward. Technology, like everything else, we see the computer has given up on me. I don't know, maybe the computer has worked very hard. So again, I want to appeal to the general public to remain vigilant as we are still in the peak of the hurricane season. We ask you to remain in a high state of preparedness and continue to monitor your local weather forecast from the Met Office, the National Emergency Management Agency, NEMO, and the Nevis Disaster Management Agency and local radio stations. I must highlight the cooperation and assistance given to us today by the ZIZ. The crew worked very hard today to support our activities. I also want to acknowledge the general managers for the cable and flow and Digicel, who use their platforms to send out information on our behalf. This is the first time I am actually had that opportunity to use their platform, and I think it was extremely helpful. So I want to thank Mr. David Lake, Miss Dion Mtaj, and also I cannot leave out the cable CEO, Pat Walters, who was very instrumental in bringing those activities together on behalf of the NEOC to ensure that information was disseminated to the general public. So to you, Ms. Pat Walters, thank you so much, and we appreciate the partnership with the cable and all the other telecommunications agencies. With that said, I want to thank everybody who responded today, and we look forward to your questions going forward. Thank you, Mr. Williams.
Thank you, Mr. Samuel. I now invite the chair of the Mitigation Council, the Attorney General, Honorable Vincent Byron, to address us.
Thank you very much, Mr. Lesroy Williams, our Master of Ceremonial host for this program. And good evening to all who are listening and viewing us this evening. This briefing has become such an important feature for us here in St. Kitts and Nevis in keeping us up to date on the response that our country has had to COVID-19, the coronavirus. And as a platform, it also allows us today and going forward to speak to any disaster, any crisis that we may have in our country. Today, this evening, we are thankful that we continue to cope with COVID-19, and we have been thankful, or we are thankful as well, that we have been spared any serious threat from the weather systems that has been in our region, sub-region, overnight today, and will be with us going forward. We note that you would have heard, as you would have heard, that the weather conditions are improving and no longer pose a threat to us here in St. Kitts and Nevis. Although we expect some intermittent showers overnight, we expect that conditions would return to normal by tomorrow morning. And as such, we would hope that all non-essential workers in our country will return to work as normal. We had put a recommendation that non-essential workers stay in place today, that only essential workers will turn out to work. But come tomorrow, we expect that all workers would return to work as normal. We also want to let you know that as of 9 o'clock this evening, the National Emergency Operating Center that had been activated in case there was a much more serious threat to us, will stand down as of 9 o'clock this evening as we prepare for more normalcy. I must remind all of us, that as we return to a measure of normalcy, that we are still under state of emergency, that emergency powers regulations are still in place, and we expect all our citizens to adhere to those regulations. The coronavirus pandemic has not gone away, as we see on international media on a regular basis that to the north of us, the United States of America, has seen increased surges in confirmed cases. As our CMO, Dr. Laws, has reported to you earlier in this briefing, that over the last recent times, we are having the highest number of confirmed cases. I think she reported something like 2 million cases over the last week or so. And so it's very much with us. And the fact that we in St. Kitts and Nevis have been able to cope adequately with this pandemic, the fact that we have been able to flatten the curve, to close our borders, and ensure that our people have been safe, does not mean that we can be complacent. We understand that as we go forward, we have to consider the risks in trying to balance our economic affairs with our health concerns. Our first priority has been, and for now continues to be, the health of our citizens. But we are slowly going to have to consider how we can get back to some level of economic normalcy as we had been accustomed to. And that is, how do we address the opening up of our borders? When will we be in a position to do so? And these considerations are very much before the federal cabinet. We are very conscious that we must make a considered decision, but we are being cautious, we are being very careful, and we want to keep our public in the loop as we do so. So I just want to implore all of our citizens to continue to follow the protocols that have been established: hand sanitizing, the wearing of masks. Dr. Laws has clearly stated, as has Superintendent Henry before her, that things such as mass gatherings must not happen, that we must be very careful not to be in a position to transmit or to somehow catch this COVID virus that's around. And we know that in our region, at least one of our states has what seems to be community spread, where it becomes very difficult. We cannot afford to have our health systems threatened, overwhelmed. We are a very small nation. We have done exceptionally well. And we will work with you to ensure that we continue to be safe, that we continue to the best we can for our family, our friends, and our whole society as we go forward. So once again, we are thankful that the weather has passed us, that we have not had any serious threat, any damage, and we hope that as we move forward, we continue to adhere to the regulations of the COVID-19 response that we have in place. Thank you very much. Good evening.
Thank you very much, Honorable Vincent Byron, Chair of the Mitigation Council. That brings us to our question and answer segment, and I haven't received any questions. So it means then that no questions. I would therefore like to thank Mr. Elmer Burke, our Senior Met Officer, Mr. Brian Dyer from NEVIS, the NEVIS Disaster Management Department, Mrs. Claricia Langley-Stevens, the Deputy National Disaster Coordinator, and Mr. Jomo Williams from SCELEC for sharing with us, Superintendent Cromwell Henry, Chief Medical Officer, Dr. Hazel Laws, Chair of the COVID-19 National Task Force, Mr. Abdias Samuel, and he's also the National Disaster Coordinator, and our Attorney General, Chair of the Mitigation Council, the Honorable Vincent Byron. I also thank Mrs. Christmas Jacobs for her dedicated service of providing us with sign language for a very important population among us. I also thank the media for continuing to partner with us in terms of providing information, whether it be on the COVID-19 pandemic or any sort of a tropical disturbance. Information is very important in managing any disaster. Information that is relevant, official information. We also thank all of you for joining us today for this press briefing as we continue to update you, and so that you, of course, the general public, can be better prepared and better aware to stay safe and to stay healthy in any sort of disaster. With that, this brings us to the end of our briefing, National Emergency Operations Center briefing for today, the 29th of July, 2020. Continue to stay safe. We will be back next week, Wednesday at 5 p.m. for our COVID-19 briefing. Thank you very much. I am Les Roy Williams.